I'm confident we can put work in today that will last someone their lifetime, if it's done right and the bite's handled well. And the materials are that good. As long as we put things in harmony with the bite and the teeth, they'll hold up and last. We don't get collapse, we don't get failure, we don't get breakage of porcelain, because everything's in harmony.
My whole life has been worrying every day, not just at some point during the day, but like almost every hour I would have some thought about how embarrassing my teeth were. It was just really bad, and so I was very cautious about where I smiled, and Dr. Gleave has had a reputation, it's not just from what I've gathered, but from everyone, that he's the best dentist that there is, and so I wanted to look good, and I was willing to go through the efforts, and finally, when we finally made the decision that we were going to do it, it's been great ever since. I mean, I now don't even have to think about it in a day. In fact, the only thoughts that I have on it are that I actually feel proud, you know, like I smile and I go, hey, you know, they see me smile, and people ask me all the time, you know, how much is it going to cost for me to get my teeth, or where can I go to get them done like that? So I've gone from feeling very embarrassed. I've gone from watching television and seeing all these people with perfect teeth and wanting that, to now not envying that at all and feeling like I now have that. Now what's my next thing I'm going to be worried about? So it's gone from a big part of my life now to something that allows me to focus on other things in my life. So, and I will tell you, there's a reason why I continually come back aesthetically, and for all of the comforts that you want to have as a patient, the concerns about the pain that you might have, and the ability to give you a pre-med so where you don't feel a lot of that 2 or 3 hour appointment has been great, and his assistant Brenda has helped me so much. I mean, I can call her anytime, and she's always there and always ready to help me, because they realize that you know, that this isn't just a simple feeling. This is my life. This is my life, and I'm one of the most particular patients you could have had, because I'm just very about everything, and so I feel really proud. I feel proud of not just the way that it turned out, but just the way that this whole process has taken place. So
Madison's case is certainly, like I said, more complex. He also, as a patient, has a lot of anxiety. I have a lot of patients that are anxious. I think all the patients we've talked today, I've sedated every one of them. I didn't realize that, but I think I have. But it's something I prefer to do. I want the patient as relaxed as we can. We use some sedation. It's nice. Madison, we use a little more sedation.
That's for sure.
And he is particular, and that's important, because I'm particular too. And Madison is one that I've engaged because I want him to understand what's going on in his mouth. I want ultimately a patient to be responsible for the care we're doing. Yes, I get the patients often that say, you're the dentist, just do what you think. I don't practice that way. I'm very educational. I want to pull out all the pictures, I want to pull out their models, I want them to be informed. Ultimately, I may have to make some decisions, but ultimately I want them involved in that process.
Right. He's the best. He's the best. There is no other comparison. I truly believe, in my experience, and I've experienced a lot of dentists. I probably have had, 12 or 13 over the years because of the problems with my teeth. He's absolutely the best, and I recommend him to everyone who needs any type of, whether it's some small filling or major work. You think he's paying me to do that? I'm telling you, it's the truth. He's not.
Dr. Gleave has been an absolute teacher for me in how to care for this stuff, and also in preparing it. He did a really great job. The procedure was flawless. They even had a problem with one of the teeth as they came in, and Dr. Gleave could have installed it incorrectly, but he said, no, let's do it right. And actually everything has turned out great. And the staff has been great. They've been very helpful and everything. And I just can't say enough about this place. It's been a great experience.
Dr. Gleave was just wonderful with me. He really was. And I'm no spring chicken. So I've been around the block. I'm not a person who is, shall we say, easily led. Once I have confidence in a person, I'm certainly willing to put myself in their hands. But you have to convince me. I have to really believe that a person knows what they're doing. And Dr. Gleave knows what he's doing. And I had absolute confidence in him. He was very patient with me. He was very gentle, very sensitive to the fact that I was just flat afraid. I've had some experiences in my past with dentists that were less than professional and less than gentle, and that's putting it politely. So I really come into any dentist with kind of some trepidation. And Dr. Gleave was able to put me at ease very, very rapidly. And now that's no small task in my case.
Just, I would really recommend him. I'm planning on bringing my kids, my family up here. I trust what they tell me. I really trust him. If he recommends something or tells me it's in my best interest to do it, I don't feel they're having dentist work done that doesn't need to be done. I'm very comfortable, and I would recommend the office to anyone.
Dr. Gleave, first I want to tell you thanks for just taking the time today to spend time with us and explain to me what actually reconstructive cosmetic dentistry is. I mean, this is a whole, I don't know if you call it a new level or this is actually pretty exciting for people. People can completely change their lives.
Oh, it's been my pleasure, Mike.
Well, I mean, it's unbelievable. Tell me though, just because what do you think the biggest mistakes people, I mean, I obviously now know after spending a day with you that there's a lot of stuff that goes on that people should be concerned about. But what is it that you think, what do you think the biggest mistake people make when it comes to taking care of their mouth?
I'd say one of the biggest things that is really an issue is there's a tendency of a lot of patients to try and minimize, they want to treat the problem, but they don't want to treat it. They don't want to really address the full problem.
You think they want to put a Band-Aid on it?
Yeah.
And oral hygiene, what's that cause?
Well, oral hygiene's one issue, and certainly things deteriorate, but also there's decay. And so the teeth are suspect to decay. And when they're not addressing the decay issue, the solution becomes a lot more complex to treat and address. It also becomes a lot more expensive. And not just a little bit more expensive, it's significantly more expensive. It could be even 10 or 20 times more expensive. And it's not just the expense, it's the time, it's the visits, it's the time off work.
Well, and I don't mean to cut you off, but it's the health problems that could result. I mean, it's just amazing that it can go on and on. It continues to grow. With that being said, everybody sitting at home right now watching, learning, what would you like them to know? What's the one point you want to make sure after watching today, after meeting your patients, after seeing after all of this, what is the one thing you hope everybody that hears or listens to you today, what do you hope they learn?
Well, the key points I think that would be a take-home for anyone would be if you've got concerns about your smile, if you've got concerns about the health of your mouth, there's solutions out there. Dentistry has evolved. There's some wonderful treatments that are available to everyone that not only can make your mouth healthier and your whole body healthier, but enhance your life, improve the lifestyle, whether it's from a more stable bite or a more aesthetic smile.
Okay, and I know you can't guarantee anything, although I heard you guarantee your work for years, so I know you can't guarantee this will help per se, but if, as a patient, I go to a dentist, what do you think maybe 3 or 4 questions I should definitely ask? Would it be how much continuing education you have? Would it be how much have you done this? Do you know about cosmetic reconstructive dentistry?
Yeah, there's certainly a lot of it. That's partly why I designed a website. In my office, I want people to understand the cases we've done. I've written a lot of important information there so that they can do the research. But they should look at other websites and just Google the important parts that you want to learn about.
So you think an educated patient's the best patient?
Oh, absolutely.
And I don't want to put you on the spot, but we are out of time. If somebody has questions or concerns, Googles it, can't find it, even maybe if they're not coming to you, is it okay if they call your office? Will you help them?
Absolutely.
All right. Well, I want to thank you for spending time with me today.
I appreciate that.
You've been watching Medical News Network. I'm Mike Wittgenstein. For future information on this subject or any other, please visit our website at medicalnewsnetwork.info. Until next time, I wish you good health.
Welcome to an educational